Hi everybody, my name is Brenda Merritt. I'm the Dean of the Faculty of Health, and today is Saturday, March 28th, and I'm out here enjoying the fresh air and sunshine on my front porch, and I just thought I'd come in and tell you what's been on my mind this week. Um, we're about 2 weeks into our remote working, and students are 2 weeks into a new way of interacting with their courses and learning online, um, new way of interacting with peers and faculty, etc. And I got to thinking this week, after 2 weeks has passed, around the internal and external narratives that we have around this social distancing and need to not physically connect with one another. And I'll just tell a little bit about my story of what has happened over the last few weeks, where I think after the first week I had this internal narrative going on around I can't leave the house, I can't go to restaurants, I can't go to the gym, etc. I can't go see my friends, etc. And I got to thinking of that narrative, and it created this sense of deprivation for me and scarcity. And it kind of got me just eager to get the heck out of the house. It got me really feeling deprived of all of the things that we typically do. And this last week I worked on that a little bit, and I changed that narrative to I get to stay home. I get to be a part of the solution. I started thinking about our healthcare providers and our first responders. They can't stay home. They are out there on the front lines keeping us safe. And I also started thinking about our small business owners and how they're not able to go to work. They're not able to keep their stores open. And I thought, I can be a silent soldier in all of this to help flatten the curve, to help us all get back, get our shops open, create some safety and normalcy in our healthcare systems. I can be that silent soldier that stays home, that helps prevent the spread of the coronavirus. And then I set it upon myself, just creating this personal challenge of how many days can I go without physically connecting with another human being. I have virtually connected, but not physically. And it's become kind of almost like a fitness challenge for me, or a health challenge of I'm going to do my part, and I'm getting quite competitive within myself. And I urge you to get it competitive as well. How many days can you stay home? How many ways can you think about not having to go out to the grocery store, etc.? And I do this for our community and our first responders and our healthcare providers because we need to do our part. Anyway, those are my thoughts this week. And how do you change your narrative from that deprivation mode to a positive mode of being a part of the solution? Anyway, I hope you're staying safe. I hope our students are learning for many of the students, learning a new way of interacting in course. And be safe, stay home, and keep in touch.